Good morning all. Today we are going to discuss about a new topic, root canal irrigants. This is a very important topic. You get a lot of questions every year for your university exam in KUHA's curriculum. You can see that this question was asked in January 2020 question paper as an essay question. Classify root canal irrigants. Mention the role of irrigants in the success of endodontic treatment. Add a note on chlorhexidine as an irrigant. So you had a question from this chapter as an essay question. You get a lot of questions, short notes, short essays, etc. from this chapter. So these are the points I would like to discuss today. Introduction, history, functions of root canal irrigants, ideal requirements of root canal irrigants, classification of root canal irrigants, under which you have chemically non-active irrigants, chemically active irrigants, recent advancements in irrigating solutions, parameters for evaluation of efficacy of irrigants, technique of endodontic irrigation, then delivery systems, irrigation delivery systems, irrigation protocol, then about conclusion. So coming to the introduction part, there is a saying that root canal instruments shape the canals, whereas root canal irrigants clean the canals. So by saying this, it means that root canal instruments shape the canals. So together it is called as cleaning and shaping procedure, whereas the root canal instruments takes care of shaping the canals, whereas the root canal irrigants clean the canals. To explain this, I would like to add few pictures. So when you think of root canal anatomy, this may be a picture coming into your mind. Like it's a very simple anatomy, or root canal anatomy can be simple or straight, something like this. But this is not the case actually. We can see that the root canal anatomy is complex, as it is shown in the second picture below. Or sometimes when you take the CBCT of a tooth, you can see that it is more complex like this, with a lot of lateral canals, branching canals, ramifications, etc. So this is the importance of a thorough cleaning and shaping procedure. By saying this, I would like to tell you that, so when the root canal anatomy is so complex like this, practically it is not possible for any root canal instruments to reach into the ramifications of these canals, or any lateral canals, or any branching of these canals. So here is the importance of root canal irrigants for taking its action of reaching into the ramifications or lateral canals and clearing away of the bacteria and other organisms. Now let us move on to the functions of root canal irrigants. So you can see that these are the main functions of root canal irrigants. First one is lavage of debris. So when you use an irrigant to irrigate the root canal systems, it manually helps you to clear away the debris of the root canal system. That is any microbes or their products, or any necrotic pulp, or whatever products, infective agents and microbial products that is harboring within the root canal system, that is cleared off from the canal by using a root canal irrigant. The second one is tissue dissolution. Here again, the primary goal of root canal treatment, as you know, is to eradicate any infection and any infectious agents within the root canal system. So here, when you attempt a root canal treatment, you have to clear away all the debris, including the tissue, that is the pulp tissue, which is present within the root canal system. So tissue dissolution is one of the main function or a requirement of any root canal irrigant that is used. Next one is lubrication. When you use a root canal instrument for instrumenting the root canal system, certain irrigants like EDTA and other irrigants, they helps to give you some kind of lubrication for your instruments, so that the instruments does not get fractured easily. And the next point is chelation. Certain root canal irrigants again helps you by providing a chelating effect like EDTA, and this aids in removal of certain calcified canals, or sorry, to negotiate the calcified canals, and helps you to achieve thorough shaping of these canals. Next one is antibacterial action. So the irrigants, when used as a antibacterial agent, again helps you to clear away any bacterial byproducts and helps you to achieve disinfection of the canals. And next one is bleaching action. To a limited extent, few irrigants provide a limited action of bleaching of the tooth. Next point is possess a certain amount of radio opacity. So these are the functions of root canal irrigants. I shall repeat once more: lavage of debris, tissue dissolution, lubrication of the lubrication effect for the cleaning and shaping procedure, chelation, and antibacterial action, then bleaching action. And the last point is possess a certain amount of radio opacity. Now let us look into the ideal requirements of irrigants. Again, these are the ideal requirements of any root canal irrigants. First of all, just like any other material, it should be having a low toxicity, and it should be biocompatible, and it should have a low surface tension. This property is very important. When a root canal irrigant is having a low surface tension, it is very easy for that irrigant to reach into the ramifications of the canal and lateral canals and accessory canals, etc., and clear away the microbes, etc. Next point is low neutralizability. It should not be easily neutralizable when you apply it into the root canal system as an irrigant. Then easy availability. Next point is cost. It should be cost effective like any other material. And the next point is convenient for usage. And the next fact is good shelf life. It should have a good shelf life, and it should be easy to store. So these are the ideal requirements of irrigants: low toxicity, it should be biocompatible, low surface tension, low neutralizability, easy availability, cost effective, convenient for usage, then good shelf life, then easy storage. Now, for approaching this chapter for your university exam purpose, I will give you certain tips. Like, if you memorize this whole chapter under these headings, that will be very useful for you to memorize for your university exam points under a few headings, like introduced by, that is any irrigant which is introduced by whom, then its concentration of irrigants, and its or its available concentrations, then mechanism of action of each irrigant, then properties of irrigants, under which you can write the concentration of irrigant, pH of irrigant, tissue dissolving properties, methods to increase the efficacy of the irrigant, and advantages and drawbacks of irrigants, then about any interactions of irrigants. So if you memorize it under this heading, that will be very easy to collect as points, and you can elaborate this point, the whole chapter, under these headings. So I have basically prepared it likewise. Now let us go into the classification of irrigants. According to Stock, it is classified into chemically inactive solutions such as water, saline, or LA. Chemically active solutions, which includes alkalis, acids, chelators, oxidizers, antibacterial agents, detergents, and enzymes. According to Walton, it is classified into irrigants are classified into dentin softeners, where you have chelators and decalcifiers, then lubricants, then desiccants. Again, chemically inactive solutions. So basically, for an example, you have water, saline, local anesthetic solutions, as explained in the previous slide. So basically, these are chemically inactive solutions which helps for flushing out the debris from the canal system. These are basically non-toxic. These are easily available and they are economical also. Again, I would like to repeat these points. Chemically non-active solution, you have water, saline, local anesthetic, whereas chemically active materials, you have alkalis like sodium hypochlorite 0.5 to 5.25% concentration, then chelating agents like EDTA. The expansion of EDTA is ethylene diamine tetraacetic acid, then oxidizing agents like hydrogen peroxide, carbamide peroxide, antibacterial agents, chlorhexidine, bis-decalinium acetate, then acids, then enzymes, streptokinase, peptide, trypsin, then some detergents like sodium lauryl sulfate. Now let us go into the details of these irrigants. Most commonly used irrigants which we are using in our day-to-day clinical endodontic practice. So first of all, chemically active solutions where you have sodium hypochlorite. This was introduced by a physician, Henry Disdale Dakin, during World War I to treat wounds. The advantages are it has tissue dissolution due to its high alkalinity, and it has high lubrication potential and antimicrobial and bleaching action. Sodium hypochlorite is very economical and easily available. Usually, it's available at a concentration of 0.5 to 5.25% concentration, whereas the higher concentrations are not so palatable for the patients. So clinicians usually tend to use a combination of a concentration of usually between 2.5 to 3.5, but this is used in all these concentrations, 0.5 to 5.25% concentration. Now coming to the mechanism of action of sodium hypochlorite. The removal of organic tissue by sodium hypochlorite is by the release of hypochlorous acid, which reacts with insoluble proteins to form soluble polypeptides, amino acids, and other byproducts. At body temperature, reactive chlorine in aqueous solution exists in two forms, hypochlorite and hypochlorous acid. It can dissolve the entire pulp in 20 minutes to 2 hours. So this indicates a high activity of sodium hypochlorite. It can dissolve the entire pulp within time period of 20 minutes to 2 hours. 5.25% sodium hypochlorite penetrates into the dentinal tubules and dissolves the contents of the tubules adjacent to the main canal. Now, if you look into the mechanism of action of sodium hypochlorite, the destruction of bacteria occurs in two phases. First one, the penetration into the bacterial cell wall. In the second step, chemical combination with the protoplasm of bacterial cell and disruption of DNA synthesis. Sodium hypochlorite is more effective in removing both inorganic and organic debris. Flushing with 10 ml sodium hypochlorite removed any remaining organic tissues, thus leaving patent dental tubules on the surface of the canal walls. So it's a highly alkaline solution. pH of sodium hypochlorite ranges from 11 to 11.5. Its concentration, as I told you earlier, it ranges from 0.5 to 5.25%. Usually 2.5 to 3% concentrations are preferred by the clinicians because of its bad taste. Now, let us see what are the methods to enhance the activity of sodium hypochlorite. So, there are certain methods to increase the efficacy of sodium hypochlorite. The rate and effectiveness of solution can be enhanced by heating the solution to 60 degrees centigrade, then using a larger volume of reagent. So, that's a very important point. The volume of irrigant is very important. Giving it ample time to work. Antimicrobial action of sodium hypochlorite takes place through two modes. The first one is by the action of the chlorine ion. Second one due to its high alkalinity. Factors affecting its antimicrobial properties are diluting 5.25% sodium hypochlorite inhibits its antimicrobial property significantly. Bactericidal effectiveness of 5.25% sodium hypochlorite decreases over time. Storage life of 3 months for undiluted preparations is available according to Martin, and it maintains a remarkable degree of antimicrobial activity in the presence of organic matter like blood and serum albumin. So that's a very important point with regard to sodium hypochlorite. It maintains a remarkable degree of antimicrobial activity in the presence of organic matter like blood and serum albumin. Now coming to the disadvantages of sodium hypochlorite, it causes mild to severe cellular damage and toxicity if extruded beyond the apex. It has high surface tension, which decreases its dentin wetting capacity. It's a caustic solution and can cause inflammation of gingival tissue. And it has an unpleasant taste, odor, and its vapors can irritate the eyes. It tends to corrode equipment. That is another drawback of sodium hypochlorite. It tends to corrode few root canal instruments, and it can bleach clothes if spilled over clothes. It may cause pharyngeal edema and esophageal burns if swallowed. So these are the disadvantages. I would like to repeat: causes mild to severe cellular damage and toxicity if extruded beyond the apex, which is usually known as sodium hypochlorite accident. That is usually asked as a short essay or a short note for your who has part 2 BDS exam, and has high surface tension, which decreases its dentin wetting capacity. It is a caustic solution and can cause inflammation of gingival tissue. It has an unpleasant taste, odor, and its vapors can irritate the eyes. It tends to corrode the equipment. It can bleach clothes if spilled over the clothes. Then it may cause pharyngeal edema and esophageal burns if it is accidentally swallowed. Now, as I told you earlier, this is another university question you get every year. Toxicity of sodium hypochlorite to periapical tissues. Or the question can be like this: describe sodium hypochlorite accident and its management. Now let us see the toxicity of sodium hypochlorite to periapical tissues. So the inadvertent injection of sodium hypochlorite beyond the root canal system causes this problem. This manifested as severe pain, edema, profuse hemorrhage, both interstitially and through the tooth. It may cause upper airway obstruction, and this may be followed by for several days by increasing edema, ecchymosis, tissue necrosis, paresthesia, and it can even cause secondary infection. Majority of cases show complete resolution within a couple of weeks. In some cases, there may be long-term paresthesia or scarring. So the toxic effects of sodium hypochlorite on vital tissues include hemolysis, epithelial ulceration, and necrosis. You can see an image of instance of sodium hypochlorite accident. The patient would have been operating especially on a lower molar for endodontic purpose, and accidental spilling of this sodium hypochlorite at the periapical tissue area causes this one. It can result in hemolysis, epithelial ulceration, and tissue necrosis. So this mishappenings can range from damage to the patient's clothing, splashing the irrigant into the patient's or operator's eye, and injection through the following the injection through the apical foramen. So what is the cause or how it happens? Basically, this is a hypertonic sodium hypochlorite is a hypertonic solution. So when it is accidentally spilled or it is extruded through the periapical area, since it's a hypertonic solution, it draws the blood from the capillary blood to the interstitial spaces, causing bleeding into the interstitial spaces. And the resultant symptoms. Now let us see the treatment for hypochlorite accident. So first of all, immediate reassurance of the patient. Ask the patient to remain calm and assist the patient in remaining calm. Recline the chair to decrease pressure from the head. For immediate pain relief, nerve block or local anesthesia, nerve block can be given. Immediately, wet cold compression is given. This is continually applied to the face for relief of pain and burning sensation and minimize swelling. So for up to a period of 6 hours. So wet cold compression. The basic idea is to arrest the bleeding process. Then immediate aspiration of any remaining sodium hypochlorite within the canal system. You can aspirate with a endodontic purpose, the syringe and needle used for endodontic purpose, like a 26 gauge, 27 gauge needle. Analgesics after emergency treatment. So as for emergency treatment, first of all, you have given the nerve block and local anesthesia to make the patient relieve of the pain. Then wet and cold compression, then aspiration of the any remaining sodium hypochlorite that is pulled inside the root canal system or at the periapical area. Then analgesics after completing the emergency treatment. To control inflammation, you can give corticosteroids immediately IV for 3 days, and to prevent infection, antibiotics is prescribed for 1 week. Because when sodium hypochlorite accidentally, when it has gone to the periapical area, it can damage the periapical tissues and it can result in a tissue necrosis. And at that area, you can expect an incidence of secondary infection. So that is why you are to prevent the secondary infection. That is why you are giving analgesics. And the purpose of giving corticosteroids is to reduce any inflammatory reaction. Then after sending the patient home, ask him to apply heat packs or warm mouth rinse to improve circulation to the area. Advise the patient about the anticipated swelling and echinosis. Give the patient both verbal and written instructions. Reassure the patient that he will regain his normal appearance within a short period. So after sending home, you're advising the patient to apply heat packs. This is just to improve circulation over the area and to increase any healing procedure, tissue healing procedure. Now moving on to the next irrigant, physiologic saline or normal saline. So this is available at a concentration of 0.9%. It's a very good irrigant to use as it causes least apical tissue irritation or damage. It is highly biocompatible and it causes least amount of cell lysis. Irrigation followed by ultrasonic and sonic instrumentation have been reported to be almost as effective as 0.5 to 2.5% sodium hypochlorite irrigation, according to some studies, in reducing the number of bacteria in infected root canals. So it is considered as one of the safest irrigant. The drawbacks are does not remove the smear layer and it merely flushes out some of the superficial debris from the canal system. It has poor antimicrobial properties. So these are the drawbacks of normal saline as an irrigant. Does not remove smear layer and it does not it merely flushes out some of the superficial debris from the canal system. It has poor antimicrobial properties. So the tissue dissolution property also is very much limited when you compare it with sodium hypochlorite. Now moving on to the next irrigant, hydrogen peroxide. So this is an oxidizing agent which is used as an irrigant. An oxidizing agent which is used in a concentration of 3%. It is active against bacteria, yeast and viruses due to production of free radicals which attack several cell components such as proteins and DNA. So this irrigant, hydrogen peroxide, you have to remember the concentration. Usually it is used in a concentration of 3%. It's an oxidizing agent It combines chlorhexidine and hydrogen peroxide at combining chlorhexidine and hydrogen peroxide at low concentrations is found to be have a greater antimicrobial activity against E. faecalis than the tested medicaments alone. So E. faecalis is considered to be one of the species, bacterial species that can even remain within the root canal system even after a successful root canal treatment. Almost always used in this irrigant, almost always used in conjunction with sodium hypochlorite, according to Grossman. Now, moving on to the mechanism of action of sodium hydrogen peroxide, it rapidly dissociates into water plus oxygen, where it is the nascent oxygen here. On coming in contact with the tissue enzymes, catalase and peroxidase, the liberated oxygen produces bactericidal effect, but this effect is transient and diminishes in presence of organic debris. So it says that on coming in contact with certain tissue enzymes like catalases and peroxidases, the liberated nascent oxygen produces bactericidal effect, but this effect is very transient and diminishes in presence of certain organic debris. So this irrigant produces a transient but energetic effervescence, which can mechanically force debris out of the canal. So basically, this is its highly beneficial property, which we expect from hydrogen peroxide. It is having energetic effervescence, which can mechanically force debris out of the canal. Resultant nascent oxygen production as a byproduct of their interaction is toxic to the anaerobes. Permeability of dentinal tubules is increased, allowing deeper penetration of intracanal medicament. Certain amount of bleaching action is also brought about by hydrogen peroxide. So it says that the permeability of dentinal tubules is highly increased, allowing deeper penetration of intracanal medicament following the irrigation with this hydrogen peroxide. Now coming to the another irrigant, urea peroxide, which is also a oxidizing agent that reacts chemically, liberating great amounts of nascent oxygen. So urea peroxide is having a bactericidal action, whereas effervescence removes pulp tissue and remnants and dentin particles. So there are certain combinations of this irrigant like Endo-PTC, which has 10% urea peroxide, and Tween 80, which is a detergent with a concentration of 15% used here. So many concentrations are available for this urea peroxide as an irrigant in the market. So it's having a combination of detergent and has hemostatic properties. This irrigant is non-allergenic and it is not irritating to periapical tissues, used in small curved canals. Property of lubrication without dentin demineralization, prevents root perforation, effective even in presence of blood. Disadvantages are less effective in removing smear layer when you compare with sodium hypochlorite. Now moving on to the next irrigant, glyoxide, which is also another oxidizing agent.